Okay. Thank you all for joining today. I'm very excited about the healthy lifestyles and wellness um, webinar today or session today that we have within the conference. I am very excited that we are continuing week 2 at the EPIC conference, and my name is Dr. Cari McIlduff, Assistant Professor at Community Health and Epidemiology at the University of Saskatchewan. I'll be chairing the 6th session of the EPIC conference, Healthy Lifestyles and Wellness. But before we begin today's session, I'd like to note a few things. So first, the EPIC conference sessions are taking place on Zoom from 12 to 1 until Friday this week. We encourage you all to attend all of the sessions if you can, and check out the AgeWell EPIC conference webpage to download EPIC conference program. Which includes details on each of the challenge areas. And then you definitely are invited to watch a recording of last week's sessions. And then later, if you are missing some of this week's sessions, to do the same. I'll begin today with my short presentation on Healthy Lifestyles and Wellness challenge area, sorry. Then we'll enjoy 2 research presentations followed by 5 minutes of question answer. And then following that, we'll get to see a featured supported startup at the end, and we will have a Q&A after that as well. So I'm excited to introduce the EPIC conference presenters today, Noorain Mamdani and Dr. Manuela Kunz. They'll be presenting on using design thinking to build augmented and reality tools for effective balance training for older adults. Jenna Keeble and Shauna Krajacich will present on co-design of nurse-led digital care model to support breast cancer survivorship and healthy aging. Finally, Emily Johnson will join us. She's the founder and creative director of Stronger You Senior Fitness, and she'll talk about how Stronger You Senior Fitness is moving the dial by improving quality of life for Canada's older adults. So all attendees today are encouraged to use the Q&A box to ask questions, leave a comment on a question, or even upvote the questions that others have submitted. We welcome also for you to use the chat if that is easier for you. So this is an opportunity for you as our conference attenders to engage with the work that's already happening within AgeWell, to contribute to an overall discussion that places the presentations in a larger discourse and addresses potential research and real-world impact. This session is being recorded and will be available for playback. So check out the links on the EPIC conference webpage or on the AgeWell YouTube channel. Okay, so without further ado, let's begin my short introduction to the challenge area, and then we'll get into the more exciting parts of our session. Okay. So we're going to be talking about healthy lifestyles and wellness, and I'll get into that a little bit, but I did want to start with a land acknowledgement. I know there was one at the beginning of the conference, but I am currently on the Treaty 6 territory, the homelands of the Nehiyawak, Nakawe, Dakota, Lakota, and Nakota, and the homelands of the Métis Nation. So I know that everyone's on different treaty lands, maybe ceded or unceded, but I want to just draw attention, particularly as we begin today, to the National Center for Truth and Reconciliation logo that's in the bottom right-hand corner of this slide. The 2 pieces that I'm going to draw our attention to, just to encourage you on your journey of reconciliation within Canada, is that the circle is actually, so it's a logo that has a lot of meaning, but the circle has 4 entrances into the circle. You can see slits in the circle at north, south, east, and west. And this is really an invitation for all of us to be part of recognizing our colonial history and how that continues to impact people today. And then that there looks like a flame in the middle, and that little yellow flame is actually representative of the children yet to be born, and what is our responsibility to make a better world for those children yet to be unborn. And what that looks like for each of us is very different, but a huge part of what that looks like is really about making sure that our older adults are available and being able to age in place well so that they can be a huge part of kids' lives. So without further ado, I'm just going to draw our attention to AgeWell's vision, the Canada's leadership in technology and aging that benefits the world. And then the mission to develop a community of researchers, older adults, caregivers, partners, and future leaders that accelerate the delivery of technology-based solutions that make a meaningful difference in the lives of Canadians. So I am not going to go too far into what the session is going to be about, but I just wanted to draw our attention to healthy lifestyles and wellness and how it is about more than just self-management of mental and physical health. It's also about social economics um, and contextual factors. So what I did do is I was reading a source a few days ago about inequalities in health-related quality of life and functional health on aging population, a Canadian community perspective. If you know anything about myself, I'm all about community perspectives. And this is by Singh et al. 2024. And one of the greatest parts of this project was that they spatially mapped, showing that regions of lower quality of life for our aging populations were actually in the prairies and Western Ontario, whereas regions of higher quality of life for this population were concentrated in Quebec. So just kind of a little bit of context there. So obviously there's some gaps that we need to be filling, and some of them are regional. Okay, so there's obviously other things like focus on autonomy, independence. So that's more of that social, economic, and contextual factors, addressing social and economic factors, which is a huge piece. And then collaboration and partnerships. We can't do anything without the older adult population. If they're not leading and guiding this work, then we're not really doing it for them. And so I'm just going to briefly mention I've previously done some work with Indigenous communities here in Canada around how do we address needs within the aging remote populations. So we've done some work with wearable devices for tracking activity and increasing health and wellness. We've done some work with health technology for monitoring various chronic health conditions. And then we've looked at some tablet accessibility and mobile connectivity for addressing health information in remote spaces. Currently, we are working, so I mentioned a little bit about without the direction of community partners, patient partners, it sometimes feels a little bit streamlined, but with the direction of those community partners, oftentimes we go off on a tangent. Like you can kind of see with my current work, is looking at technology for monitoring environmental health aspects that impact food security, and how does that relate to older adults and aging? Well, particularly for those living remote and those relying on the land, climate change and environmental injustices are really significantly impacting the way that they're able to age well in place. And then future work, we just got funding to explore barriers and facilitators for Alzheimer's Society of Saskatchewan to facilitate virtual care partner support groups for Indigenous care partners. So just a little bit about me and my work and what I'm bringing to this space. And I am going to just give a little bit of these numbers. I'm going to put the numbers on the screen. Lots of amazing partnerships and people within AgeWell that make AgeWell a success. And today I'm going to draw your attention to the 5,000 plus engaged older adults and caregivers. We have one representative of a patient partner here with us today. And then we also have 70 plus startups that are supported by AgeWell. And we have one representative of that today here as well. So very excited now to move on to our presenters. So Miss Noorain Mamdani, sorry, Noorain, and Manuela Kunz. Noorain is a master's student at McMaster's University in the Health Research Methodology program under the supervision of Dr. Alexandra Papineau, I believe. Noorain is a 2024 EPIC AT Master's Fellow and is conducting research on age tech solutions at the Jarvis Center for Aging Research in Hamilton. Before attending McMaster, Noorain earned her Bachelor of Science in Biomedical Science at the University of Guelph. Manuela Kunz is a Senior Research Officer with the Digital Technologies Research Center at the National Research Council Canada, where she's performing research in the area of computer vision and graphics. Before joining the NRC, she worked at Queen's University in the Department of Surgery and the School of Computing. Dr. Kunz earned her master's in science and computer science at the University of Hildesheim? Yep, knew I was going to get that wrong. In Germany, and her PhD in biomedical engineering at the University of Bern in Switzerland. So, with no further ado, I will stop sharing and allow Noorain and Manuela to share.
All right. Good afternoon, everyone. Thanks for the introduction, Cari. I'm Noorain Mamdani, and I'm presenting today with Dr. Manuela Kunz. We will be talking today about how we can use augmented reality to create balance training tools for older adults to reduce falls, increase engagement, and adherence. One of AgeWell's priorities is encouraging co-creation. So instead of creating these tools in isolation, we have prioritized involving healthcare professionals and older adults every step of the way to ensure that the tools we create aren't only innovative, but actually meet the real world needs of older adults. So the problem we're facing is falls. Falls are the leading cause of injury among older adults, and they can be prevented through consistent balance training. But this is often inaccessible and expensive. So allowing older adults to access balance training from home can address these issues and improve their health outcomes at the same time. A published meta-analysis by Sherrington et al. They found that balance training and resistance exercises, if practiced regularly, can reduce the rate of falls among older adults by 34%, which really highlights the importance of physical activity for older adults. And while there are home-based regimens that exist, they're often failing to engage older adults or they're difficult to use. And healthcare teams are unable to track progress and they're unable to track patient adherence and if the patient is even exercising correctly. So this is where our proposed augmented reality-based training system comes into play to address these issues. I'll just go over quickly what augmented reality entails. It's essentially a technology that adds simulated features into your physical surroundings while allowing you to maintain a connection to your physical environment, compared to virtual reality, which places the user in a completely virtual environment. So augmented reality is an alternative that doesn't require the user to wear or hold any equipment while they exercise. So our development process for this study uses the design thinking framework to ensure that the end user is kept in mind throughout the whole process. The framework is a 5-step process that's iterative, and we are addressing the first 3 steps, empathize, define, and ideate, through focus groups with older adults and healthcare professionals as the participants. The focus groups are going to be conducted using a curated list of guided questions that follow the design thinking framework to encourage discussion. The first step is empathize, where we're going to understand the current practices and the challenges that older adults face when using balance training technologies and what their current regimens are. What frustrates them? What could make balance training easier? Or how do they feel about using technology? Through the second step, define, we will be identifying key issues such as difficulty using technology, or a lack of motivation, or poor usability. The third step, ideate, will focus on brainstorming solutions and collecting feedback on the system and possible additional features that could be added to enhance the user experience, like visual cues to guide movements or a simple user interface. We're also going to collect feedback from the participants through quantitative questionnaires. The system usability scale, the net promoter score, and the technology acceptance model, which are widely used quantitative questionnaires to assess the usability and acceptance of novel technologies. And during the prototype phase, we will be refining and developing the technology further to incorporate these solutions that came up during the focus groups, to integrate real-time feedback, and also include customizable exercises. The final step, test, will involve validity and feasibility testing with older adults to gather further feedback to refine the system. So it's clear that older adults need solutions that are not only effective, but that are easy to use. And this technology that we're proposing has the potential to guide users through exercises, adjust difficulty levels, and provide instant feedback, all of which are crucial for effective balance training. The proposed system can transform custom written clinical recommendations from healthcare professionals and translate that into a visual program that can be easily followed by older adults. Healthcare teams will be able to choose from a library of movements and even custom add new exercises that fit their patients' needs. The system will provide real-time feedback to correct user movements to ensure that they're optimally exercising, and it will even adapt to the speed of the user doing the exercise, which can ensure that the user is exercising at a speed that is suitable to them. Our goal for this system is to be a scalable product, one that can be integrated both in the home environment and the clinical environment. And the system will only require users to purchase or rent a low-cost camera and a small device that can be just plugged into a TV or monitor, allowing older adults to use the system easily. And the system will be able to relay the patient progress directly to the healthcare team, which can be used to transition patients to regimens that actually meet their needs. And our goal is to eventually have this system provide comprehensive care in the future by including other rehabilitation exercises, possibly cognitive training and strength building exercises, which can allow users to have a full, well-rounded care at home. I'm going to hand it over to Dr. Kunz now, who is going to go over the system application.
Thank you, Noorain. This project is part of the National Research Council's Aging in Place program. So this program aims to develop technology and innovations to support older adults in their choice to age at home or in their community. So as Noorain has already mentioned, falls are a frequent occurrence in the aging population and can have serious long-term consequences for the older adult, such as disabilities or decreased mobility. So for example, it is observed that 2 of 3 older adults with a history of falls experience excessive fear of falling, which results in activity avoidance or hesitation to participate in social interactions. These can limit the quality of life for the person dramatically. So the loss of independence, which is associated with many of these consequences, increases the probability of requiring residential long-term care for the older adult. So with this project is therefore directly linked to the aim of this NRC program or National Research Council program. As part of this program, NRC is developing technology to track and assess older adults' movements. Can you switch to the next slide, please, Noorain? Here you see just a very small example of tracking movements of a person using a commercial low-cost 3D camera. For each frame of the video, the pose of the person is estimated using open source AI method in this case. So pose information are represented to easy analyze and to easy store as skeleton data. So these little line figures you are seeing there. So these pose data can then be used to analyze over time or can analyze the movement over time. So for example, detecting the walking path, walking speed, we can detect repetition in the movement, joint angle, as well as highlight differences between the desired movement and the real movement. So in collaboration with academic research partners, we are also developing post-estimation and analysis methods, which are age diverse and cost efficient, which we believe is essential for a successful transfer of the technology into a product for older adults. However, similarly important is the design of a final prototype, with the older adult in mind. And this is where Noorain's work will provide very unique and essential insight for the design process. So we hope that the co-creation process will result in a tool that is effective and user-friendly for the older adults and the healthcare professional similarly. Besides this, we hope that we can also make the training fun to increase the adherence and effectiveness, and that we develop a system which can be done at home. So yeah, thank you very much.
Wonderful. Thank you so much, Noorain and Manuela. So any questions? There's the Q&A box in this bottom. That was almost perfectly on time. You guys must have practiced. There's no questions in the chat or the Q&A. I have a question while we're waiting. Something that you said was more around, a few things that you said were more around accessibility and inclusiveness. Is there a need for internet access to do some of this? I'm thinking for more like remote communities, obviously they don't have as much connectivity.
No, we are so one of the reasons why we are developing our own post estimation with with academic partners together is to have a very small model versus the very large models, which can run locally. It is also for protection of privacy reason. So we are targeting, or we are aiming to develop a product which doesn't rely on internet.
Perfect. Thanks so
Yeah.
much. While you're answering that, there are a few questions that come in. That's awesome. Is this vision-based mobility tracking assessment available to small community yet? I am from Grey Bruce.
Noorain, do you want to answer these? Or?
Yeah, I think that's a great question. We're still in the very early stages of developing the technology and currently doing the focus groups. So once the focus groups are completed, there will be, as I mentioned, the prototype phase, which will go back to the NRC to develop the technology. And then there will also be validity and feasibility testing again at McMaster and the GRS Center, after which hopefully it will be available for users to purchase and use in their homes. So still a while to go, but hopefully we'll be able to deliver a system that's user-friendly.
That's exciting. Thank you. So there's a couple of more questions. We'll go to, do you need green screen for camera to analyze? Notice the green curtain in the slide. That was from Elizabeth.
Oh, maybe I can answer these. So the green screen is in this video mostly to hide the mess in the lab. So yes, it will not require a green screen. So we made or actually our academic collaborators made a very big effort to train the system with normal home environment in much more busier environments than what you have seen. So it should be able to use it just in your living room as you normally find in a house. Sorry, that was a long answer for no, the green screen is not required.
That's great. Thank you. I'm so glad that I'm not the only one that uses screens to cover up mess. And so there was another question that came through. What are the costs associated? You mentioned rental or purchase, but generally what the cost might be.
Noorain, should I answer these?
Yeah, I think it'd be good
Yeah.
for equipment costs.
To be honest, at this point, it is too early to say because we are still in the developing process. And for a final product, it would, of course, also involve an industrial partner. However, we had a very intense testing of different hardware for division components for this product to find the low-cost solution which can give us still the accuracy which we need. So we're trying to, at least from the hardware side, to keep the costs down. Also, I cannot provide concrete numbers at this point.
Okay, great. There was another question. How could one be involved in this study or group?
Noorain, I give this to you, yeah.
So we're hoping to host our focus groups in the next couple of weeks. We have reached our capacity for healthcare professionals, but if you are an older adult above the age of 60 and might want to participate, then I will leave my email in the chat and you can send me an email and you can reach out and maybe we can put you into a focus group to give us your feedback.
Amazing. Thank you. There was also a question about security issues. Are there any security issues that you know of to date?
Yeah, as I have mentioned that we are trying to keep everything locally on our little box, and so there will be no data going out in the cloud. We are as Noorain has mentioned, we are very early on in our development, but we do have partners here at the NRC in the cybersecurity, which also have a special focus on healthcare data, and we will at one point involve them to make sure that there are no security issues in using the system.
Awesome. I know that that is always a big concern. So, you've got a couple of wonderful work. Thank you. This has a potential to greatly benefit the elderly community. There is a question in the chat, so I'm gonna actually start introducing the next presenters while you guys engage with that, if that's okay. And that's really about if you've tapped into the accelerator program yet. But I'll let you engage in that in the chat. But thank you so much. This was a great presentation.
Thank you.
Thank you.
Okay, so without further ado, we will go on to Jenna and Shauna's presentation. So Jenna is a research analyst at the University Health Network Center for Digital Therapeutics and a recent graduate of the Master of Public Health program at the Dalla Lana School of Public Health at the University of Toronto. She's leading the first phase of the Embrace Co-Design project, conducting and analyzing interviews with people diagnosed with breast cancer and their caregivers to inform the initial design of the virtual program. And Shauna is a patient partner and breast cancer survivor. Her lived experience and professional expertise in patient advocacy at Rethink Breast Cancer will provide us with the insights into how survivorship care can be reimagined to prioritize the perspectives of people diagnosed with breast cancer and their caregivers. So I would invite both Shauna and Jenna to jump on and share their screen, and they'll have a 10-minute presentation as well. And again, please jump into the Q&A with questions, and we will address those after.
Great. Thank you, Cari. Hello, everyone. Good afternoon, good morning, depending where you're joining us from. As Cari mentioned, I'm here today to talk to you about my lived experience through a very specific and unique part of the breast cancer experience, the survivorship phase, and how that's impacted me. And my partner, my co-presenter today, Jenna, is going to also talk about an exciting piece of technology that could help people like me and other patients through that part of the experience. And so we're really excited to get into that. But first, just to tell you a little bit more about my lived experience before we get to talk about the Net Embrace app. I'm Shauna. I was living the typical life of a 31-year-old when suddenly I was diagnosed with stage 1 breast cancer. It's HER2 negative, hormone positive. I was 31. It was back in 2018. And needless to say, this was a very startling experience. And suddenly I had to navigate this whole system. And it was a steep learning curve. My, only real perspective on what this could look like was through television shows and media. And let's just say it was nothing like, a Grey's Anatomy episode I might have enjoyed. There was no McDreamy coming in to help save me. Instead, I was surprised to learn there was a lot of questions that I needed help answering, and a lot more questions that I had to sit with before we can get answers, which now that I'm on the other side of things, I understand. And so it had so much anxiety, but it helped meeting my team, knowing that I was going to see my team regularly, and they laid out a plan for me. So for me, that was surgery, chemo, radiation, and as Cari mentioned, I also work with patients in my daily job, and similar to them, once you get that plan going, there's almost a sense of comfort. Obviously, no one wants to go through chemo, radiation, surgery, but knowing what comes next really did help at that point of my care. So, of course, that was tough, but knowing that I was going to see my oncologist every 3 weeks, knowing exactly who I can contact at the chemo center while I was getting my treatments was really helpful. And just overall, despite it being terrible, I knew how to be, let's say, a good patient. I knew what the ticks on my checklist were. I knew what came next. And so that gave me some sort of sense of relief despite it being a terrible time. And then once I was done, I had chemo for 3 months, followed by about 2 months of radiation, let's say. Um, and at the end of that is when I reached what we call in the community and in the medical community as well, the survivorship phase. I was done my active treatment. I was continuing treatments moving forward, but not going into the cancer center as often. So enter the survivorship phase. Um, Yay, you're done your, very intense active treatments, but now you're moving into a unknown area where you're maybe only seeing your doctor every 3 months, every 6 months, once a year. So there's a significant drop in the amount of appointments and touch points. And then you're trying to reapproach your everyday life. So suddenly, I personally went back to work. Maybe you're just, accepting more responsibilities again in your life. And so the responsibilities from your old normal life, let's say, if we want to say like suddenly increase while your touch points and direction from your team decrease. And then for many breast cancer survivors who enter the survivorship phase, although your active treatment is done, you're starting new treatments that you're doing for maybe 5, 7, 10 years, and those come with new side effects. And the side effects, there's a laundry list of them that it could be, and oftentimes the side effects from the treatment can overlap with some of the side effects that you're asked to look out for a recurrence. And so that brings a lot of anxiety. And without those touch points and those appointments in the calendar to really know, okay, I know on this day I'm going to be able to speak with my oncologist or a nurse or someone on my care team about what I'm feeling, it makes it feel the anxiety just kind of grows from that unknown. And without that clear path of having, when I was in my active treatment, I knew, okay, I knew I had a number to call. This is who I can reach out to. I knew that if I had a fever or had exact things that I knew I could reach out to with my team if I needed to contact them. But when I was in the survivorship phase, it wasn't so clear what really warrants me reaching out to my team. Am I bothering them? I don't want to burden an already, stretched healthcare system. And so there was this need for a clear path. And that would have really helped me as a patient. Eventually, I was connected with an aftercare cancer care clinic through Women's College Hospital. I was able to connect to psychosocial supports, but the road to get there and the road to consistency and me kind of settling into this survivorship phase took a while. And it's not, again, through my work, I work with many community members and they've communicated something very similar. That the survivorship phase is full of murkiness and maybe unneeded anxiety and a lot of unknowns that potentially technology can help bridge that gap. So I'm going to pass it off to Jenna, who has stuff to talk about in that place.
Amazing. Thank you so much, Shauna. So as you just heard, many people feel uncertain after treatment, disconnected from care, and unsure about what comes next. This gap in follow-up support can be especially challenging for older adults, particularly those 65 years or older, who make up a growing proportion of people diagnosed with breast cancer. And with an aging population, supporting healthy aging for those navigating survivorship is increasingly important. We need a model of care that helps people move from fear, isolation, anxiety to feeling connected and supported. So to address this need, we're developing NED Embrace, a nurse-led algorithm-enhanced virtual care model, adapting the NED program for people who've been diagnosed with prostate cancer. And it's designed to support people who have been diagnosed with breast cancer and are transitioning out of curative treatment, offering accessible, structured support for the survivorship phase. So Embrace, like I said, is designed to support people navigating their ongoing care and wellness. So they will have access to self-management tools that are available on a mobile device, again, dependent on the internet for right now. But virtual visits can reduce travel time and increase flexibility. And nurses will lead the care clinic using a holistic person-centered approach. and information will flow more easily from the care team to caregivers and patients. And we also have a feature that we'd want to include where a caregiver can co-manage the account on behalf of a loved one. So this can reduce digital barriers, especially for older adults who may want assistance navigating these new tools. So currently we are in the needs assessment phase of developing Embrace. So we're identifying what we need to include in the clinic. And this means listening to people's experiences through a couple of different techniques that I will go over a little bit later. Then we will be co-designing solutions together and then planning for the pilot clinic setting and then deploying it and later scaling it more broadly. So like the previous presenters, we are also using this interactive co-design approach. And we want it to be as inclusive and an iterative process that centers people who have been diagnosed with breast cancer. We are using tools like semi-structured interviews and demographic surveys prior to the interviews that include how many years someone has been living post-diagnosis, something that can potentially indicate when considering aging-related needs. And we also offer in-person options for project surveys and interviews to reduce digital barriers. And we're working to challenge ageist assumptions. Instead of assuming older adults can't or won't use digital tools, we're asking how accessible does this model feel to them? And what would help it better support different needs or comfort levels? And this helps us to create a model that supports aging in place and something that will hopefully center equity. So far we have completed, actually this has changed, we've done a couple interviews since then, but about 8 interviews out of 10 that we're aiming for so far. And this is just kind of according to me because I've been conducting the interviews, but some themes that I'm seeing are related to social financial well-being and allied healthcare. So people want access to social workers, financial support, and allied healthcare expertise, which are critical to wellness later in life and early in life as well. Accessibility and emotional support. So I've heard that technology can feel like an added burden when someone is already navigating a very serious health condition. So participants have really spoke about the value of accessible support staff to help them learn and navigate the system even repeatedly. And we're also working with long-term care homes to ensure people have access to devices like iPads that can support their Embrace accounts. We have also interviewed one participant who actually lives in the long-term care home. So through the interview process and setting up, we were able to confirm that they did have access to an iPad. And we're also considering how to support non-digital users without caregiver assistance. And we're also a little bit alert to referral bias because this is a quality improvement project, not a research project where adults who may not appear tech savvy due to stereotypes may be unintentionally excluded from the quality improvement recruitment process because we need to go through clinicians to get these referrals. And then these insights are really prompting us to think more about targeted research and age-inclusive strategies. I'm running a little bit out of time, but we also have education and community connection and just some educational content and also personalized clinical care that includes mammograms, screening, radiation, surgical, and medical oncology, just really integrated into one workflow. So thank you so much for listening, and we're really excited about Embrace and the potential to support healthy aging. If you'd like to connect or learn more, feel free to email me or Shauna, and we're happy to discuss. Thank you.
Thank you so much, Jenna and Shauna. I think this is a really great option, and I think it'll be just really there's opportunities for generalizability to other survivorship journeys. So this is a great. There's a couple of questions already. So this one's for you, Shauna. At the age of 31, how did you go about it, knowing that at least in Ontario, we start mammogram recommendations at the age of 40 to 74?
Yeah, I guess maybe I'm interpreting that as how did you find your tumor and seek out care? So for me, I think very commonly with people my age, we've found it like in the shower or you're scratching your chest or something, and then you kind of notice something, and that's how I found it in the shower, and went to my family doctor who then referred me for an ultrasound because mammograms are not necessarily the most effective tool for that age group. Many people in my position, though, will bring it to their family doctor, and because it's so rare at that age, will be turned away or put off. So I was lucky that in my journey, that wasn't my case, that I was moved through right away and got care.
Great. Thank you so much, Shauna. It's so lovely to see presentations where community partners, patient partners' voices are so prioritized and put forward. So thank you for having such a strong voice. So one question for Jenna was, great work. Do you have a formal advisory committee that puts decision-making power into the hands of the people with lived experience? This can be a valuable co-research tool if you haven't already considered this.
Yeah, so Shauna is our patient partner for this project because we're in early stages, but we've applied for a grant and we want to add more members to this advisory committee as we kind of go through the process. We just want to make sure that we're doing it like ethically. We can have the funds to properly compensate people. So we are definitely wanting to do that. We're very open to Shauna's recommendations too on how to beef up the advisory committee if we need to.
Great, thank you. So there's another question in the Q&A. Our OHTs are promoting mammogram and pap testing for older women who might otherwise not be able to get out. Is this an initiative that we can promote to them?
Absolutely. And I think we're just by doing these interviews, we're learning about all of these provincial programs. I know the high risk screening program too, that we need to be in alignment with and also to touch base with. Just to integrate their expertise with ours, but also like make sure that we can refer people to, or we'd love to collaborate and get them to procure eventually the service and offer it more widely to people across the province.
Wonderful. I think that's all of our questions, except there is one. Can you please put your contact information in the chat, or multiple contact informations, because there's two of you. And I will just make note, I know that we have a question and answer period at the very end of our session today. And I know that Shauna is a very busy lady and has to step out. So having Shauna's contact details in the chat will also help you to reach out to her if you think of something as the day goes on. Okay.
Absolutely.
Sorry, go ahead, Jenna.
Oh, I'm just going to put my contact in the chat.
Perfect. Thank you for doing that. So now we are going to jump into our featured supported startup. Emily Johnson is the founder of Stronger You Senior Fitness. She is on a mission to innovate and elevate senior fitness globally by empowering recreation, fitness, and wellness professionals and senior serving organizations to deliver high-quality senior fitness classes. Stronger You Senior Fitness is a globally unique fitness education company that trains staff working in retirement communities, long-term care homes, and other senior serving roles through their senior fitness instructor courses and monthly class content for recreation and fitness professionals to learn and teach to their groups. So I will invite Emily to jump in and
Yes.
have a 10-minute presentation from you and then Q&A after that.
Wonderful. Hi, everyone. My name is Emily. I'm the founder of Stronger You Senior Fitness. Excited to be here today. I'll start by telling you a little bit about my journey to found Stronger You and AgeWell's sort of special place along that journey. So I started my career after graduating kinesiology in community chronic disease management. So working with people who had recovered from heart attacks, strokes, people with COPD, diabetes, really any chronic condition that you can think of. And most of these individuals were older adults wanting to be their healthiest self. And we worked with an incredible interdisciplinary team. So we had kinesiologists, we had physiotherapists, we had PSWs, nurses, speech language pathologists, nutritionists, like really any professional you can think of was a part of this amazing team. And so I just had this incredible opportunity to learn and grow. And then I came into my next career opportunity, which was in the senior living sector. And again, I was just absolutely blessed to work with an individual who also had a background in kinesiology and had such a unique and high quality approach to the senior fitness classes that she taught. And so because of that, our retirement community that we worked at, the seniors there, they loved fitness. They were all about fitness. And it was just an amazing, amazing program that we had put together. Then I went on to my next role in my career as a life enrichment manager. So now stepping from that assistant role into that manager role. And in that role, I inherited 2 recreation assistants on my team. And as part of my onboarding, sitting in on programs, I, of course, was very interested to sit in on the fitness programming. And I was shocked, not in a good way. Unfortunately, the quality that I was just used to my entire career of what senior fitness classes should be, could be, was immediately turned on its head. And here we had 2 people who had no background, no training in teaching fitness classes, teaching fitness classes. So immediately I was like, whoa, we have to pause this. We need to give you proper training, and then I will let you resume teaching after that. So that was my first kind of wake up call that the quality of senior fitness out in the world wasn't maybe always the quality that I was used to, that my participants in the past were used to. And as part of that role, I started to do some onboarding and regional work where if a new life enrichment manager was hired, I would go out and I would onboard them. And again, I was like, wow, I sat in on this new person's fitness class. And during the fitness class of the very first person I onboarded in that role, she had a participant fall down because she was doing something unsafe at the front of the room as the teacher. Luckily, the person was exercising in front of a treadmill, which was not on. And the treadmill broke her fall. It's funny, you would think that that's a lucky thing, but if she had fallen all the way to the ground, there's a chance she could have broken her tailbone. She could have ended up in hospital where she could have contracted pneumonia or a cold or other infections, and literally could have been, on her deathbed because of someone's mistake at the front of a fitness class. So this kind of kept happening to me where I kept seeing like, wow, who we're allowing to teach senior fitness classes, the quality we're allowing of fitness classes is really, really scary out there. And in my next career step before founding Stronger, I was the regional manager of recreation, overseeing 49 retirement communities across Canada, BC, Alberta, Saskatchewan, Manitoba, and half of Ontario was my region. And out of the 49 that I supported, only 3 were offering high quality fitness classes. So it was just throughout my whole career, I'm just stunned, and I'm searching and I'm looking, what is a solution for these professionals to be able to teach high quality fitness classes? They are all expected to teach fitness classes. They're not expected to have trainings or certifications. How can we get them the training that they need? And I was really surprised that there are many amazing courses, senior fitness courses out there in the world. But what I was looking for specifically was something that was pre-choreographed, where not only they would get the education that they need, but they would get the actual class content that they can learn and teach. Because having taught fitness classes for more than half of my life at this point, I know it's a long learning curve, and it takes lots of mentorship and lots of years and lots of learning from participants to really teach high quality fitness classes. So I was surprised to not find anything. And then I kind of end the story as it goes. Out of frustration and passion, I decided to found Stronger You Senior Fitness. And how AgeWell works into all that is when I had the idea of, you know what, I'm going to do this, enough's enough. I'm not just going to wait around anymore. I'm going to be the change I want to see. I saw the application for the AgeWell National Impact Challenge. So submitted Stronger You Senior Fitness, which was just an idea at that time, was selected. And part of the application was you needed to have a website and be incorporated. So I did both of those things just for the application, and sort of the rest is history. So now nearly 6 years later, and all the impact we've made, AgeWell was such a special thing along the way. So the curse of being last, I know we're running out of time. I'm going to kind of breeze through these slides. And of course, I'll give you the contact information for me at the end here. So if you haven't gathered yet, we're an education company, first of our kind globally. And because of that, because we're the only solution who does what we do, we have a huge presence across North America, but also internationally, because people in the UK, Australia, New Zealand, they're Googling like I was way back in the day, looking for something like Stronger You, and they're reaching out. And so we really focus our service to recreation, activity, and fitness professionals, life enrichment professionals who primarily work in senior living organizations. So anywhere from long-term care, assisted living, independent living, all the way to community-based organizations, 50+ senior centers. And now for the past few years, we've been working with post-secondary colleges and universities who actually put the Stronger You instructor course right into their curriculum. So that way students are graduating as Stronger You senior fitness instructors from their programs. And our goal is to bridge the gap between knowledge and practice. Like I said, there are so many amazing senior fitness courses out there, but the gap is in that once you take a course like that, you're so new, you're not really sure how to take that knowledge and put it into practice. It takes years, it takes mentorship, it takes trial and error. And our population is aging. We don't really have time for a decade of trial and error until you've got a really good honed in quality class. So our goal is to take people from the bottom of that learning curve, a brand new person never taught fitness, right to the top to teaching high quality expert classes right away. And along the way, debunking misconceptions about aging and exercise. So not all senior fitness classes are, let's just do a little overhead stretch, as we see in so many of the visual graphics depicting senior fitness classes, but how do we help our older adults to prevent falls, prevent chronic disease, or live better with their chronic diseases, and really get stronger and live more years independently. So we do it through a few ways: online, accessible, self-paced education. I've taught so many fitness workshops, fitness courses in person, and you have half of the group that's yawning because they have a background in kinesiology, they've heard this before. You've got the other half with eyes glazed over, they have no clue what you're talking about because like they've never heard any of this before. So online, accessible, self-paced education was always important to us at the beginning to ensure every learner can learn according to their unique ability. And then at the end of that strong foundation, that knowledge foundation, we actually give them the 30 minutes of seated and standing class content to learn and to teach to their group, not just in one format, but 4 formats: cardio, strength, stretch, and circuit, which is our balance program, to really ensure they can help older adults to meet the physical activity guidelines. And we really take a unique approach in that it's not just about the fitness, it's about more than that. So a big focus on intellectual programming, dual tasking, things that are really good for the brain, on the social experience, because of course we know social isolation is one of the biggest problems of our time right now. And then emotional connection to the program, sense of purpose and vocation. So we really try to wrap up a whole lot of meaning into one 30-minute class. These are the steps: online course. They practice the class, they submit a video to become fully certified, and once they get fully certified, their video has been marked, they've received a passing grade, they then gain access to that 30 minutes of ongoing class content. And then just want to quickly mention, this is something we've just developed in the last year and a half now, I'll say, and it's a physical activity self-management program. So it's a 14-week program available to all of our instructors, designed to empower the participants to move their bodies and take control of their physical activity habits. So we do a health and fitness self-assessment and goal setting workshop to start. There's weekly education and peer support sessions. The group plans together this program and celebration. So it really takes it from passive participant, just sitting in a fitness class, who cares if you show up or not, to a community-based opportunity to learn and to be empowered along your physical fitness journey. We get amazing feedback on the course. Average score 9 out of 10, most commonly awarded score 10 out of 10. Really don't have time for this slide, but basically first blurb, someone new to teaching fitness was using YouTube, like some of the scary fitness classes I saw in my career, and now they were Stronger You certified. Second person is what I would call an expert, teaching fitness classes for 30 years, highly qualified, but again, became Stronger You certified as well as her whole team, because they wanted that high quality program to keep in their toolkit. So we really serve everyone from never taught fitness before, all the way to have been doing it their entire life pretty well. And then lastly, we actually just added to our repertoire of programs, and now we have this incredible program called the Drum for Seniors instructor course. And this is an amazing program that is a unique combination of drumming and mindfulness. So the drum and the ohm, so drum. And so this certification and course empowers people to deliver drumming, movement, and music and mindfulness. Again, using our same Stronger You model of education and then class content to learn and teach to the group. So yeah, I know I'm over time, but we've left some time for questions, and I'll put my contact information in the chat as well. So thank you so much, everyone.
Okay, wonderful. Thank you so much, Emily. So there was a question that came through already. Sorry, I'm having trouble starting my video. Thank you. That came through already, and they are asking, do older adults take the course as well? That would be great.
Yeah, that's a great question. So we have a lot of people in their retirement age. You know, they're might be in their 60s and their 70s, and they want to empower their peers by becoming a fitness instructor themselves. So we do have seniors who take the course and then teach their peers. I can think of so many seniors apartments where they don't have programming, let's say, but it's all seniors living in the building. And we have a few of those who the instructor is just someone who lives in the building and wants to teach a class for their peers.
Awesome. So when you complete evaluations, do you find folks are noting benefits beyond strength and confidence building to an improvement in their feelings of connectedness?
Yeah, absolutely. We don't have any research that we've been able to do. We would love to do that, but everything we gather is anecdotal, and we really do hear that. Like, people don't just come for the fitness. They come because they have a sense of purpose, because their job is to hand the water out at the beginning of the class. They come for the social connection. They come for the music. They come for that they want to keep going out for lunch with their girlfriends, and they had a trouble one time getting off the toilet, and now by coming to Stronger You, they can get off the toilet easier and they can keep going out to lunch with their girlfriends. So, it's definitely not just about the physical. That's one part of it, but we see far reaching benefits from the participants.
Amazing. There's a couple of questions here about cost. One says, with all the cost cutting for LTCs, what's the cost for LTCs? And another, what's the cost for being an instructor?
Yeah, so the only cost there is for the instructor course and their first year of monthly class content. So that's $466 Canadian. And we actually have something called annual turnover protection, because the turnover of recreation professionals in this industry is quite high. They are either not cut out for the job or they move on to somewhere new. And so that can sometimes be a barrier in why organizations don't give their team training, because they're going to have to keep paying over and over for the new person to take a course. So what actually happens with ours is they take the course, $466 plus tax. And if that person leaves within 1 year of registration, the organization reaches out to us and lets us know they have a new hire. We transfer the registration over to the new hire.
Amazing. And just for sake of time, because there's a couple of questions in the chat for you, so I'll let you get to those.
Sure.
Do you have any specific exercises for seniors with special needs, mentally, physically challenged?
Yeah, we work with everyone. Like, even people use this in the community living, adults with intellectual disabilities area too, because there's really no programs designed for them either. And then also adults with dementia, Alzheimer's disease. Like, we have all of those different populations use our program, and we really teach you how to modify it so it's perfect for whatever special population you might be working with.
Amazing. We have 2 minutes left, but so there's also a question about the seniors getting assessed for their condition, sorry. And then as the other presenters jump in, we just want to ask if you can think about what your motivation for undertaking being involved in, what's your motivation and what are your hopes for the future? But Emily, I'll let you get to are the seniors getting assessed for their conditions?
Yeah, so we talk about the senior fitness instructor course in the course, sorry, senior fitness test in the course. And it's optional, of course. Not every organization is going to use that. Because we work with a lot of retirement communities, there is typically an assessment done by the nursing team. And so each organization would have that specific to them, but it's not something that we mandate.
Okay, thank you. So for the rest of everyone that's still here, what are your motivations for undertaking this work, and what would be your future aspirations for the work that you're doing? And then Emily, I'm just going to draw your attention to the chat. There's a couple questions in there for you. Thank you. Don't everyone jump in at once. Noorain,
I'm
Noorain.
unmuted, so I'll just go real
Okay,
quick. Yeah, we just want to spread high quality fitness classes. You know, it's hard to know exactly how many seniors we touch, but it's somewhere between the 50,000 to 150,000 range right now, and we just want that to keep growing. And for me, not to wander into random fitness classes and be like, oh gosh, and start wandering into more and being like, wow, this is amazing. The quality of classes we're seeing.
I guess I can go next. So this started off as a practicum position for me when I was finishing up my public health education, but I think what really drives me is connecting with the people who I have the privilege to interview, and also connecting with Shauna and just seeing the real world need for this, you know? So everyone, no matter their financial, social situation, they have access to high quality cancer care throughout the lifespan. Because you'd want the same for yourself, your loved ones, your community. So to really put that into action. And I would like to see it to its end. I'd like to see someone actually use this, even though it is a long process for product development.
Thanks. I can add on to that. I worked in long-term care quite a bit during my undergrad, and I wanted to continue working with older adults, which led me to my master's. And I've seen the need for augmented reality-based or any technology-based balance training that older adults can use from home. I personally have grandparents that are unable to travel to complete balance training, so having something that they can use from the comfort of their home would, greatly benefit their health outcomes.
Yeah, maybe I can just connect to Noorain. So it's we are all going to age at one point. So doing research to actually, help healthy aging and activity, staying active. It's something which is very uh, important for when you are talking to friends, to family, to aging parents, and we are going to get there. So it has a lot of motivation involved.
Thank you all so much, and thank you everyone for such an engaged session. The questions were great. Hopefully, Emily, you've been able to get to some of those questions. And thank you again. We are only 2 minutes over time. We could have probably talked for another hour, but yeah, thank you all.